అశోక్ వినిపిస్తుందా? వినిపించలే? మరి వినిపించింది అనేది ఎలా అనిపించింది? 10 seconds లో కదా? 5 seconds వచ్చిందా? ఏమొచ్చిందా? సరే ఆ డివైస్ ఏమి
వస్తున్నదా ఇంకా ఓకే మా లోపలికి వచ్చింది Yeah, so good afternoon everyone. So I welcome all the postgraduates from all the departments. Like previously mentioned in the circular, so attendance will be calculated. So you can call your friends also. Let them come as soon as possible. Okay, so welcome to this session. See, of late you have seen there is a lot of, what do you say, concentration on your thesis work. So to speak honestly, some 3 to 4 years before, all the PGs, they used to download some old thesis from some other university, some Rajiv Gandhi University or some research paper. They used to put it as thesis. But we don't want that to happen. See, because thesis, it adds to your profile. Don't think that you are doing thesis for the sake of Narayana Medical College or your department. You do a good thesis that helps you. It adds to your profile. At the same time, it will up the morale of the what do you say, the medical college and your juniors who are coming after you. So for that, see, we have conducted several thesis orientation programs. So for the PG, senior PGs, we conducted one thesis orientation program. For the junior PGs, we have conducted in 2 modules. In one module, we have taught you the importance of thesis, some epidemiological aspects, and module 2, you actually presented. So in continuation of that one, see, the very important part in your thesis is data collection. So unless once you are equipped with a good data and adequate tools to calculate that, I think your thesis will show you good results. So to emphasize on that one, so we have organized today's guest lecture. I would like to introduce the speaker for today's session. He is Professor Sushant Kumar Mishra. So sir has attained his MBBS degree in 1995 from SCB Medical College, Cuttack. So that is in Orissa. It comes under Utkal University. And he worked as an insurance medical officer in ESI Bhubaneswar from 1996 to 97. 1997 to 2000, he has done his MD Community Medicine in VSS Medical College, Sambalpur University. And 2000 to 2004, he worked as a lecturer of community medicine, again in the same college, VSS Medical College. And he joined GSL Medical College, Rajahmundry, as assistant professor of community medicine in 2004. So after that, he was promoted to associate. And from 2010 till date, he is working as professor there. And now he is head of the Department of Community Medicine. And 2022, he became the vice principal also. His main fields of interest: infectious diseases, research methodology, disaster management, and medical education. So he has got more than 20 publications to his credit in various national and indexed journals. And he received several awards: the Fellow of Public Health Field Leader, and which was awarded by CDC Atlanta. And he was a Fellow of FIMER, that is one advanced course in medical education. And he has done his revised basic course and advanced course in medical education. He is life member of several professional bodies: the International Epidemiological Association, Indian Association of Preventive and Social Medicine, Indian Public Health Association, Association for Prevention and Control of Rabies in India, and Academy of Health Professions Educators, and Simulation Health Society also, which he is pursuing recently. And he is member of Board of Studies for PhD courses in NTR University of Health Sciences, and he is a PhD guide also. He is a reviewer in Indian Journal of Public Health, MRIMS Journal of Health Sciences, and International Journal of Biological and Medical Research. So this is his academic career, such a prolific career. So I would like to invite Dr. Sushant Kumar Mishra to give his lecture on data collection tools and techniques. Welcome, sir.
Lights. Good afternoon, everybody. Nice to see all. I believe all postgraduates faculty are also there. Okay. So wonderful. You are the boarding doctors and the As you know, in your academic career, research is very important. And this is what we need to pursue relentlessly throughout our lifelong, conducting more and more research. Greetings from JSL Medical College. This is my college. And I'll be talking today about the data collection tools and techniques. What I would like to tell is about the difference between data and information, different methods of data collection, and various tools which measuring skills used for data collection. Now coming to data, many times when we see this, we hear this word data, we see that there is, we imagine there is a voluminous number of figures, graphs, all these things. But that is useful to interpret something. When we do a qualitative or quantitative study, data is very important. So any observation made on specimen, patient, or population is called datum. A collection of such observation, we call it data. The ideal data collection procedure should be clear, unbiased, reliable, and valid. There are 5 W's of data collection. First and foremost thing, we should find out what data is to be collected. For any research, this is very important. What data types, whether it is qualitative or quantitative. Then from whom we should collect the data, whether it is your studies, who are your study subjects, and what is the requirement to achieve your objectives. Then who will collect the data, from where the data will be collected, and when should we collect the data. So these 5 W's are important. It's very much important for data collection. Now, data and information. What we understand by data and what we understand by information. Data is something which is the raw facts. You can't attach any context to it. And these are just number and text. So these are raw data and it has to be converted into information. Information is that data with context. Is a processed data. Is a value which is added to your data. Either you summarize it, organize it, or analyze it. So for example, the first one you can see here, 51007 is a number. So if I say that number, you can't say what is it. You can't interpret what is it. Say, I can't give any meaning to this. But if I say, it could be various meaning, like this could be a date of your final exam. It could be some amount, currency, or it could be a zip code. So this is information. To be very simple, this is the first one is data, and the second one, when we attach certain meaning to it, it is information. Another example, this is a set of data. Now, when we convert it into information, we can put it in a graph so that it is analyzed. So this is information. Now, I hope you are clear about what is data and what is information and how these two are different. So what information we get with the data collection tools? 3 things we want to find out. One is facts, knowledge, and judgments. Now, facts will be by 3 processes. One is we get to know the individual characteristics. You like to know about the surroundings, environment, how does it influence the person, or certain behavioral practices which say it is a human study. we deal with patients, we study the human behaviors. So individual characteristics like age, height, clinical history, which is a part and parcel of our thesis data collection. Then environment regarding their housing, their family size, the behavioral practices like usage of particular drug, alcohol, etc. Then knowledge, how far they know the risk factors, how far they know about the healthy lifestyles. Like, for example, mosquito breeding places or any other risks which are involved pertaining to that individual or group of individual. Diet, exercise. Then last one is the judgments, like opinions. What the patient thinks about it, what you thinks about it. See the opinions, the quality of health services. Now the patients, they are treated by you. They are going back. We want to know their feedback. What the quality of services they have experienced during their stay in the hospital. So that's their opinion. Or sometimes we want the attitudes like wearing a seat belt, wearing a helmet, open air defecation. So the attitude of the people. So three things. One is facts, knowledge, and judgment. The exploratory research involves two types. One is primary and secondary research. In the primary research, generally we do the surveys, opinion polls, interviews, focus groups, and observations. Whereas in secondary research, these are the research which we do through online, literature, doing a literature search, case study. So all this comes under the secondary research. Coming to the methods of data collections, we have two methods. One is primary method of data collection and secondary method of data collection. The data collected directly from the subjects by the researchers or trained collectors, especially for the purpose of research, is called the primary data collection. So when we will be directly going to the patient, you will be collecting the information from them, set of recordings we will be conducting, like you ask certain questions, do a survey, do certain interview, observe their biophysics, physiologic measurements, BP, pulse, temperature, all these are primary data collection. But when you get the data which is collected for various other purpose and you are utilizing it in your current research, then it is called a secondary data collection. Say for example, case sheets, patient's case sheets. Now the purpose of case sheets is something else. You are obtaining the data from the case sheets, or maybe nurse's diary, notes, treatment plan, dietary plan, census. So all these we are the secondary data collection. Is it clear now? Primary and secondary data collection. Now coming to the instrument. Now what we call is instrument, it is a general term the researchers use for measurement of various devices like survey, test, questionnaire. These are all instruments. It's a technical term, we call them instruments. The instruments fall into two broad categories. One is researcher completed and another is the subject completed. They are distinguished by those instruments that researchers administer versus those who are completed by the participants. And researchers choose the type of instrument based upon the research question which they have. The difference, the researcher completed means here you and me who was conducting the research will complete, will fill this. Rating scales, interview schedule schedules, guides, tally sheets, flow charts, performance checklists. So all this comes under the researcher completed instruments, whereas subject completed instruments are questionnaires, self checklists, attitude scales, personality inventories. All this comes under the subject completed instruments. Now the data, different tools for data collections. One is the abstraction form, where we review the records, either personal records, clinical records, registers, then the structure observation guide like checklists in the text form or figure form, or it could be the questionnaires, interview administered and self-administered. Now, first coming to the record analysis. Record analysis is something where we analyze the content of the documentation material. For example, books, newspaper, archival records, documents, diaries, minutes of meetings. So these are your basis for data collection, and from these materials we extract the requirements which we can utilize in our research. The content of the written materials serves as the basis of inference, and this analysis is made mostly objectively and systematically. They are rich source of data. Sometimes it is collected over long period of time. You have wide choice to choose between large volume, but the drawback, you may require necessary permissions. It is time consuming to go through all the old data and find out what is relevant to your research. You can't assure any accuracy, authenticity, validity, or reliability. Equivalency. What is equivalency? That is when we have records from multiple sources, they may not have the data on particular variable in the same manner. Suppose you collect data from some place, some source, then another hospital you go and you collect data from their records. This format, that format will be different. So ultimately, you won't get what is required. In that case, you need equivalency. You need to standardize both the formats. So that is one problem if you are having multiple sources of data collections. Now, next coming to the biophysiologic methods. Now, this biophysiologic methods, which involves the collection of biophysiologic data from subjects by using specialized equipments. This is all we do in our day-to-day clinical practice. Temperature recording, measurement of the chest parameters, then blood pressure, and other specialized equipments. We record many physiological status, even lab also. So in vivo biophysics methods, that is internally within the living organisms which we do, but certain in vitro biophysics methods, which is the outside the organisms, for example, in the lab, blood testing and everything. So there are two types, in vivo and in vitro biophysics physiologic records. The next is the checklist. Now this checklist, it is a very easy tool. Many times we use it for many purposes. It is a list of action items which are arranged in a systematic manner. This allows the user to record the completion of the individual item. The presence or absence of each item may be indicated by checking either yes or no. It is easy to administer. These are the examples which you can see here. There is a weekly medication record and there is a checklist. The person, he will just put a check mark or tick mark wherever it is relevant. The advantage, it is you can gather huge data in a short period of time. There are two types. One is sign system and category system. In the sign system checklist, the observer either places a check mark beside the appropriate response to designate its occurrence or make a cumulative tally sheets. Here you can see this is a sign system type where you want to put a checklist here, check mark. The category system, here the observer has to place the responses in one category or only category for each element. Say for example, kitchen, there are various options are given. So you can put here under kitchen, the different dates, there are multiple options are there. So this is one with sign system, one is category system. All has its importance and relevance in different setups. It all depends upon your objectives, what data you want to extract. The uses to count the number of responses in a given period, it is very easier. To gather facts of surveys, to record observations, to rate the personality. So these are the various uses of this checklist. Many times we use this checklist. These are the advantages and disadvantages. The advantage is that it's completed, it can be completed through electronic form also. Even not, if not physical form, you can send it across distance and you can get it filled up with the appropriate check boxes. And you can obtain large volume of data. But the disadvantage, it needs validating and pre-testing also. It's a rigid method, both questions and response. The respondent doesn't have the flexibility beyond the structured checklist to respond anything. So it's a very rigid method. Next is the self-reports. Self-reports, it's a method in which information is gathered by questioning people. We need to question the people, and by questioning, we gather a good amount of data. A self-administered questionnaire is a paper pencil test. We can give it to the person, they will fill it. There are examples, self-reports, interviews. Now coming to interview, this is very important because many times we utilize it for our thesis data collection. Here, it is a technique which involves oral questioning of respondents, either individual or group. We can do telephonic interview. Telephonic interview is utilized where the people are present in a distant places. Suppose, for example, I'm giving example, we are conducting a survey. Recently, we conducted a survey for our thesis. The patient got admitted for COVID, they got discharged. Now we want their opinion about this. So how will do? Either you call them, that involves a lot of cost. Individually, you have to reimburse their travel. Another way is you reach them through telephonically. But again, you need to be careful about the authenticity and their honesty over telephone. Then face-to-face interview, it's called direct interview. This is always superior in comparison to telephonic interview. And time and place is always pre-arranged. Data is collected personally. So you will have a personal touch. You can have the opportunity to build rapport with the persons. So it all depends the speed of data collection, how speedily you want to collect your data, how much cost you would like to spend for your data collection, the internet usage, literacy level, people should be able to read and respond, understand and then respond. Then the time gap, which is more important, more common in the event, in the shorter persons of window recall. If the event has happened today and you are sending it after 1 year, then the person won't be able to recall. There will be always a recall bias. So in that case, if the person is unable to reach personally, then you have to take the decision on telephonically interview. Then sensitiveness. Sometimes we ask sensitive questions, which is better if you can do interact face to face. There are different forms of interviews. One is structured. Here that means as per the order of the question in the tool you go. You can't deviate. You design the questionnaire and in the order of questions you need to follow one by one questions you need to ask. This is called structured questions. Then unstructured questions. Here the content is controlled by the study subject. It is flexible. In sequence, you can jump the serial depending upon the nature of interview, depending on the nature of context and the sensitiveness. And third one is the semi-structured. Here it encourages a two-way communication. The respondent will have the opportunity to clarify in any question, and you can also discuss the sensitive topics. There are in-depth interviews. This is basically qualitative. Intensive individual interviews will be conducted. Usually we explore the perception in in-depth. That means in detail you conduct interview. There will be open discussions so that you give adequate opportunity to the respondents to explain his perspective. So you explore it. The last one is focused group interview. This is basically unstructured. Here the moderator will lead the discussions. A small group of pre-selected people who is having the knowledge of the particular issue, they will be selected. The moderator will start the discussion, and once the discussion goes among the participants, the moderator will stay away, and then the recording will be simultaneously going on. So these are the different forms of interview. So for all these interviews, what we need is an interview guide, the general set of questions which are used in the interview and help the researcher to lead the interview. And apart from that, we also need an interview schedule, which is a highly structured instrument which will resemble a questionnaire. The interviewer will strictly should ask the same questions as structured in the interview. Then what are the steps, various steps of the interview? When you are conducting an interview with the respondents or your study subjects, first of all, the first and foremost thing, you gain entry. How you will gain entry? It's a doorstep technique. If you are conducting a house-to-house interview, particularly in community medicine, when we are going to the field and collecting the data, we do house-to-house interview or person-to-person interview, where we want this doorstep technique is very useful. First of all, the appearance should be a professional. You should look like a professional because n number of people will be approaching them for various information. They may be from government agency, they may be from different places, even business people. So when you are approaching, you should be different from them. So you should have a thorough professional look, appearance with nicely dressed, pleasant look, all these things. You need to introduce yourself with a smile, build rapport, explain what is the purpose of the study, and seek their cooperation. Second step is use the questions carefully. There must be adequate eye contact, confidence in your voice. Ask questions exactly as it is written, particularly in a structured questionnaire. Don't finish the sentences when viewee is taking and sharing the information, so don't cut it short. Allow them to complete. Silent probe, that is called listening, active listening. Engage them wherever it's required. Ask for elaboration and clarification. Paraphrase, that means you repeat what they say that to impress that you are listening it actively. Record the responses immediately so that after that you will forget, there will be a lot of confusion. So record it immediately and conclude the interviews with thanks to them. Appreciate their cooperation and thanks, give thanks. So these are the various steps which we are, this is general steps which is useful for every kind of interview. Then schedule. Now this is something which is filled up by the researcher or by any persons which are appointed by the researcher, especially for this purpose. Here you can see the census. What happens in census? People come to your house. There is a format with which they come and they ask certain questions. They fill the format, isn't it? So that is a form of schedule. The difference between schedule and questionnaire. Schedule depends upon the honesty and competence of the researchers, how they extract the data. Here in questionnaire, the success lies more in the quality of the question. If the quality of question is good, then it will be, the data obtained will be more valid. Schedule is something which is filled by researcher. This is very important. And questionnaire is filled by the respondent themselves. So here, the respondent, when the respondent fills themselves, they should be able to read and write and understand. So the literacy is important here. Non-response will be very high, whereas here, since you personally go and ask them and fill it in front of them, non-response will be very less. And these are all other differences which we can see here. It is important, used for illiterate groups. This is only literate people, it will be useful. Now coming to the questionnaire. These questionnaires, we always use this in our data collection. It's very frequently used in various type of data collection. And this is a paper pencil instrument. It's popularly known as paper pencil instrument. And there are different types, closed-ended and open-ended. Now this closed-ended and open-ended, these open-ended questionnaires are easy to construct. And here the closed-ended, you only obtain few data through closed-ended questionnaires. You can't have a probe. You can't go in detail to extract the data. But it is easy to analyze and it is simple to administer. This is mostly used in open-ended questionnaires, or unstructured questionnaires are used for qualitative data collections, whereas these closed-ended questionnaires are used mostly in the quantitative data collection. Am I clear on this? Yes or no? Please respond. Any doubt till now? Now, different types of questionnaires which we use from time to time. One is computer-generated questionnaires, telephonic questionnaires, in-house questionnaires, that means paper pencil, or you can mail the questionnaires. It all depends how you use it and what is your speed of data collections, and how much accuracy is permissible in your research. There are 9 steps which are involved in the development of the questionnaire. One is, first you decide the information which is required. One is the research question and variables which are being used. Second thing, who are your target respondents, from whom you are collecting the data, their sampling frame. Third thing, the methods of reaching your target respondents, whether you are reaching them personally or through telephonic interview. Then decide on the questions or content or relevance. Then develop the question wording. Wordings will be different for closed-ended, it will be different for open-ended. And put the questions into a meaningful order and format. You start with the opening question, see that there is flow of questions are good, and variant of questions are also there to prevent monotony, and see that you end up with a closing question. Check the length of questionnaire, how much time it takes, how much cost it will take for your mobilization or data collection. Pre-test the questionnaire, and finally you develop the final survey form, that is with interviewer's instruction. So these are the 9 steps which we need to follow when you are developing a questionnaire. There is something called flower pot approach. Now this flower pot approach is very interesting. Here it will be designed like a flower pot. Every questionnaire will start with the instructions section, and then the first information objectives. Then you go to the generalized questions, and then you narrow down your questions which you want. So start with a generalized question so that they will feel comfortable. They will be more honest, they will be easy with you, and then you go to the specific question. So it starts with a broad question, then narrow down your specific question which we want to extract from them. So respondents identification data, cover letter, introduction, instructions, informations, and these respondents identifications. So these are the different sections. So each section of your questionnaire must start with a broader perspective, and then you narrow down what you want at the end. This is called flower pot. So it should start with introduction and conclusion. Then the presentation objectives in that, elements of information consent. So as you know, we have to take the consent of the client from obtaining the information, and then a concluding statement. Then the identifiers which are required, that will be also part of your questionnaire, like name, age, sex, what you will put it. So that also address, because for follow-up you need to go back to the address, collect and keep them apart. And these are coded with ID numbers. Many times when you don't want to reveal the identity for questions, sensitive questions, you need to put it in a coded form so that the anonymity will be maintained. Then the instructions for data collections should be there, and the body of the instruments, there may be open types, closed types, semi-open types. There are 4 theoretical components of questionnaire. First, we need to see about wordings, how we will frame our wordings. Then what are the questions? Then which format you would like to prepare, and the hypothesis. So coming to the words, these are very important because the researcher must carefully consider which words to use in creating the questions and scales for collecting the raw data from the respondents. Whenever we are designing the questionnaire, you should keep it very short and simple. The wordings should be simple. In one question, maximum 16 words. They have mentioned that anything more than that will be a lengthy questionnaire, and the respondents will lose interest. So maximum 16 words you try to restrict, and ensure that the questions are very specific without any bias. Should be focused on single issue or topic. It should be grammatically simple also. Avoid any jargons, avoid any shorthand, avoid any abbreviations. These days, many places we see that the internet languages are being used, shorthand. So all this, I mean, coded languages are being used. That will be inconvenient for the people to interpret. So you don't use this. Then avoid the ambiguous words like usually, frequently. These are the ambiguous words which should not be there in a question in the questionnaire. Avoid extreme words also. So what are the extreme words? They place the respondents in a situation where they must either fully agree with what is your question, or they must fully disagree. So for example, all, always, any, anybody, ever, every, never. These are all the extreme words which you should not put in your research questions. These questionnaires. So these are extreme words, and when you are using these words, then the respondents they don't have choice. They have to agree with the extremes. Avoid any hypothetical questions or imaginary questions. Do not use words which could be easily misheard, especially important when you are doing a tele interview. So those words we should not use. Desensitize question by using response bands. What does it mean? Whenever you are asking any sensitive questions, so for example, if you are asking a sex worker, how many times you engage in sexual activity within 24 hours? It's a very sensitive question for any person. Rather than that, you can put a response band. How many commercial sex activities you have per day in 24 hours? Say you can put it in band like 2 to 3 clients, 4 to 5 clients, 6 to 7 clients, like that. Some response band should be there. It should not be a direct question. It's very important, and this is very sensitive. Ensure that fixed responses do not overlap. They should be mutually exclusive. Do not ask any leading questions, because respondents, it's only directing the response towards an answer. Ordinarily they don't give that answer, but if you are attaching a leading question to that, definitely they will give that answer. And do not ask loaded questions. Now, what is the loaded questions? This is a form of complex question which contain controversial assumptions. Like, for example, are you mistreating a patient? What is the assumption here? When we are asking the question, As such, we are giving the assumption that the person is mistreating a person. So this is our assumption, and we are forcing our assumption on the respondent. This is something like that where the police people ask to a criminals some sort of that kind of, they always ask the loaded questions so that you at some point of time the criminals will break up and they will admit their crime. So that is a loaded question. Avoid questions with a negative in them, like do you ever. Sometimes you use double negative. So the first one, do you sometimes care for the patient without washing hands? This is a negative questions. Instead of that, you can put, do you systematically wash hands before caring for such patients? Here, no negativity is there. So that is the ideal one. Ask only one question at a time. If more than one question are there in the questionnaire, we call it a double barrel question. So for example, did you refuse treatment because you feared side effects? There are two questions here. One is you refuse treatment. Another is side effect. Do you fear side effects? So these two are clubbed in one question, and that will confuse the respondent. Instead of that, did you refuse treatment? That will be one question. You go to another question. If yes, was this because you feared the side effects? So this is a better one rather than the first one. Am I clear on this? Be specific. Are you aware about the modes of transmission of HIV? Now here, you can reframe this, like among these practices, can you tell me those that could expose you to HIV? So this is more specific rather than this is a general question. Use neutral tone to avoid influence. Have you been promiscuous in the last 6 months? Indirectly, you are putting some influence there. So how many partners have you had in the last 6 months? And you can put it in the response band also. Now, if you look at the question funnel, you will have a baseline, open, then you probe it, then close. For every question, you can start with a baseline, a context, then open it, probe it if required, so that you will go and ask for some deeper aspect, you can go and then close it. So it's called question funnel. So you can start with simple question, then you go to the complicated one, start with a general question, then go to the specific one, and start with a casual question, go to the intimate questions, group together if similar questions are there related to the same topic, start the questions in the chronological order if questions related to the sequence of events. So this is how you can go ahead with the question funnel. Now the open-ended and closed-ended questions, here you can see in open-ended question, what is the difference? The open-ended question means it is open to for the respondent to tell anything. So for example, tell me what about your study habits? Or let's take one example. If I ask you, what you have taken in your lunch today? So you have many choices. You can say I have taken paratha, I can take biryani, I can take dosa. So many things I can take. I took sambar. So you have many choices. But if I ask you, had you had your biryani today? What will be your choice? Either you answer yes or no. This is a closed type of question. You can have only two options here, yes or no. But open type of questions you can have. So I'll get more information in open type of questions rather than the closed type of questions. And these are the verbs which are used in this open and closed type of questions. There is something called semi-open type of question. Here you can see the possibility to create another answer. That means you ask a question, and then if at all any thing you want to extract more, you ask the person to specify. Did your child have complications following measles? None. Pneumonia, diarrhea, eye problem. Others, here it is specified. That means it is a closed questions, but it is semi-open here. That means see here the respondent is definitely getting a chance to specify. Then there are another variant, that open questions with closed end answers. These are expressed as an open question, but it can be analyzed and closed end questions. No option of answers is suggested. However, the answers are freely mentioned, the interviews will be ticked. So for example, what are the practices that may increase your risk of getting heart attack? And here each of the response, it is closed type. Yes or no, yes or no, yes or no. Okay. Then the closed-ended questions, coming to closed-ended questions, these closed-ended questions are various types. They are called dichotomous, multiple choice questions, multiple response questions, cafeteria questions, and there are contingency, rating scales, bipolar questions, metric questions, many variants are there. We'll come one by one. First coming to the dichotomous questions, options. Here there is two options. Dichotomous means two, either yes or no, male or female. So these are suggested answers include two options only. Advantage is very clear, easy to analyze. Here you can see these examples, only yes or no type. Then the multiple options. All of you, we are exposed to multiple options in our NEET examinations, isn't it? In your NEET examinations, MCQs were there. So these are all multiple choice questions. One or multiple answers are acceptable. Advantage, you have larger choice of options. So here these are the examples. And this multiple choice questions, they have different parts. This one is called the stem. The question, main question is called stem. These are the options. One is the correct answer and others are distractors. So these are the parts of the MCQ. One will be correct answer, the others will be the distractors. And distractors, often they are framed, they will distract, they are more similar. Where do you go seek treatment for fever? Here there are multiple options. You are very familiar with this type of options. Then there are multiple response questions. They offer more than two response alternatives like this. Here you can see, where do you use the internet? Tick all that apply. Here the respondents will get the chance to click multiple options, whichever is applicable. This is called multiple response question. This is another example. If you had TB, who do you talk to about your illness? There may be more than one option and the person can respond more than one. Next is cafeteria question. Now what is this? This is a special type of MCQ that asks the respondent to select a respondent's response most closely corresponds to their view. Example, what do you think about hormone replacement therapy? That means here they are extracting their opinion, the respondent's opinion. So it is dangerous. One should be cautious. So you can put more than one, but there is a cafeteria choice here. So, and if he thinks it is his opinion, he can say what is his liking. Then contingency or skip questions. Many times we use these questions in our questionnaire because here the question that is asked further only if the respondents give the particular response to previous question. It may not be applicable. So for example, do you have the habit of smoking? If the person is not having the habit of smoking, then the further questions are not relevant to him. So if yes, then only you can ask next question, how long? Whether it is less than 1 year, 1 to 2 years. But if it is no, then you may skip all the rest of the part of the questions. Am I clear on this? This is another example. This is called skip questions or contingency question. Then rating scales. It's very important. This is a scale with set of points which describe varying degree of the dimension of attitude being observed. Here ask the respondents to judge something along the order dimension. The respondents rate to a specific element on a scale selecting the among the points. Here you can see between 0 to 10, the rating will be there. How do you describe your pain on a scale of 0 to 10? When you are asking a patient having pain, how you are rating a scale? The patient, if say he says 9, then we can say that he is having much pain. If it is 1, then we can say it's less pain. So that's why we can rate it by putting a scale. This is called rating scale. There are different types of rating scales. These are all different types of rating scales. Now, what is graphic rating scale? This is very commonly used. We ask whenever we purchase anything from Flipkart, Amazon, we get a response, put a star, isn't it? Any commercial sites, when we are purchasing online, they ask us to rate. So this is what is the rating scales. You put a star, whether you like 5-star or 3-star. These are graphic rating scales. Star ratings will be there. You go to a restaurant and also you will have that rating scales also. Then this is called visual analog scale. Many times in a clinical setup, we use this. And mostly it is applicable for the illiterate patients who cannot read it right, children. So this is a pain scale. How much is the severity of your pain? And this is a visual analog. It is represented in some visual graphics. Here you can see another type. Different variants are there. This is called visual analog scale. This is I have extracted from my daughter's school book. She has done some kind of scale which represents the her likings about the books. So this is very also very unique. Different books are there and different ratings how she likes the books. And this also we experience in the hotels when we go to restaurants. This is also visual analog skill, which you can see here. The ambience, service, food quality, all these are mentioned here. Another for children. Then there is another scale that's called nominal rating scale. Here it's a nominal scale is a measurement of scale in which the number serves as a tag or labels only to identify the class or classify an objective. Here you can see, did you use soap during the following domestic activities during the past 6 months? Always, sometimes, seldom, never. So there is a non-numeric variables are given here. And you can indicate whatever is your choice. Another scale is numerical rating scale. Here you can see it is numerically rated, it is itemized. It is the simplest and most commonly used scales. You can see here the numerical scale is most commonly starts from 0 to 10. 0 being no pain, 10 being the worst pain. So you can put a numerical tag to the scale. This is also, there is a variant of this is called global rating scale. Endoscopy global rating scale. Here you can see the numbers are given in all these items. So again, how is the itch? Then next coming to the Likert scale. This is very widely used. You might have heard about this Likert scale. This Likert scale is first designed by Rensis Likert. It is a ordered unidimensional scale. There are 5 points or 7 points Likert scales are there, in which this allows the individual to express how much they agree or disagree with a particular statement. For example, strongly agree and strongly disagree. So there are different orders which can be put in across the responses. These are the items, Likert items. At one side, we will have the Likert items, and the other side, we can have the agreements like strongly agree, and there will be a neutral point also. So here, usually it is displayed in the visual aid, such as series of radio buttons. You can see these are radio buttons, or a horizontal bar sometimes. And all the items will be categorically similar so that the sum score becomes a reliable measurement. That is one condition in Likert scale. And here, in a good Likert scale, you will see the scale is balanced. There will be a one right wing, one left wing. In there, you can see agree, strongly agree. This is the one wing. And the midpoint is neither agree nor disagree. So this is a neutral point. This is called neutral point. And disagree and strongly disagree is the negative wing. This whole thing is called Likert scale. In the Likert scale, the items are there. Likert items will be there. The sum of the scale is the Likert of the Likert items. There is another difference between Likert and semantic differential scale. A Likert scale will provide you with the participants' agreement and disagreement with the asked statements. Whereas in semantic differential scale, it will provide you information on where the participants' views lies in a country. So you can see this example, Likert scale. I think I would like to use the system frequently. So this is the response, Likert response. But in a semantic differential scale, the overall this task was very difficult and not very difficult. So in between, you can see put a response. This is called semantic differential scale. Many times there is a confusion between these two, but this is very clear in this example what is Likert and what is semantic differential scale. So these are various ordered response which we use in Likert scale, like agreement, frequency, importance, interest. Now the midpoint is important, as I told you. This is called neutral option. This is used historically. It is a very controversial thing, as many people they think that the response they choose a neutral options to avoid. Sometimes people if more people respond to a neutral theme or neutral weightage, then either they don't understand the questions or they don't like to respond to your questions. So that may happen. So some controversy exists as to whether a neutral point should be offered. If this option is removed, this forces the respondents to choose the response, which may lead to respondent irritation and increase non-response bias. Therefore, midpoint is always necessary, and it increases the reliability and validity of the tool. What you see here in this, these are the responses, and here you have the average, good, and outstanding. Suppose you go to a restaurant, you get this, and you don't like the food, isn't it? Do you have any opportunity to say negative? So very carefully they design, and after that they will show that our customer ratings are very high and our food quality is good. But actually, you don't have any scope to give a negative. There is no negative R in a Likert scale. The advantage, easy to use, increase response rate. You can analyze rank and opinions. It saves time. But the disadvantage is hard to demonstrate. There will be a central tendency bias. If the midpoint is not there, then there is a central tendency bias. The earlier example you saw is the central tendency bias. And there are social desirability bias, where purposefully it is meant to force the choice that you either agree or disagree. So this is what happens if too much Likert usage. In a lighter note, you want a coffee or not? Strongly agree, all these things. So 7 types of bias we'll get in the survey. The participants change their opinions and behavior as a result of taking part. This is called the demand bias. Then the social desirability bias. The respondent answers your survey questions with the answer they think which is socially and morally correct. Then there is dissent bias when they disagree. Then acquaintancy bias when the person answering your survey selects yes or respondents to positive questions only. Then the persons consistently choose the option of either end. This is called extreme response. Either say agree, strongly agree, or they say strongly disagree. So this means it's a extreme response. Every time they select a neutral response, this is called neutral responding bias. And there are personal bias like wordings, questions, etc. Next, coming to another scale that is called Thurston scale. It is unidimensional scale. Again, only agree or disagree options. There are 2 options will be there. The mean or median is always calculated in that. You have label of questions. Unlike your Likert scale, you have a graded response. Here only 2 responses are there, agree or disagree. Then Gutman scale, it is also unidimensional scale. Here their cumulative scaling or scalogram analysis we do. The responses are considered according to the last agreed statement. Here you can see the peoples. I can use the toilet without assistance. Here one person A, B, C, D, E, F. Only one person, the last person said no. Other people say yes. Similarly, other questions, and at the end you put the scoring, and this total scoring matters, that is called graded, this cumulative scaling or scalogram analysis. This is called Gutman scale. Then there is another scale which is called rank order scale. The rank order scale is defined as survey question types that allows the respondents to rearrange the rank multiple choice options in a specific order. You can see here, the respondents will be asked to rank them. Various options, we will rank them according to their choice. Then the comparative rating order. Here the comparative scale is a type of rating scale that is used to measure the survey respondents' preference in terms of another similar benchmark. So say for example, there is a comparison addiction factor here, nicotine, then heroin, alcohol, these 3 are compared. Or you take a benchmark and then you compare. Say, put the benchmark before the respondents and say, this is the benchmark, in response to that, what is your response? So that's called comparative rating scale. Then self-rating scale, many times we use it. It can be a questionnaire, inventory, attitude, interest, ability, performance. The best example is this is called Jung self-rating scale, depression scale. We use it. Anybody from psychiatry department, they must be familiar with this. For depression as analysis, Jung rating scale, self-rating scale is being used very oftenly. Then forced choice rating scale. This is a type of scale that doesn't account for neutral or in-between options. Here the choice is forced. It is ipsative scale, also known as. Here you can see always what is the regularity of the job, always regular, inform the advance, absence. Here the most and least. So the choice is forced upon the person here. So one of them has to be responded. So these are the different rating scales or scales which we are used for this rating. Then coming to bipolar questions. In bipolar questions, the questions having 2 extremes of answers. Here you can say, I like going for walk, I like watching movie. There are 2 different polars. If you give a question, the person will have a choice between these 2. And the strongly disagree response has to mark their response between these 2 opposite ends. That's called bipolar questionnaires. Sometimes you use it to get the extreme answer from the patients. Then next, coming to the matrix questions, which includes multiple questions and identical response categories. Questions are placed under one another, forming matrix. Here you can see your weekly schedule and the person will respond to that. This is matrix. The response categories are placed in the top and the list of questions are in the downside. It's called matrix question. Then last one is the filler question. This is again important. The filler questions are the items in which the researcher has no direct interest. It won't be useful for your research, but these are the questions which will be asked to sometimes judge the honesty of the patient, the client. Their focus only to purpose to study. They may hesitate to answer. If so, to make them comfortable, to extract the honesty from them, we put some icebreakers. So some questions are given, that is called filler questions. Then once the questionnaires are ready, you need to do a pre-testing of the questionnaires. Let the respondents know that you are doing the pre-testing. Get a feedback on the clarity of the questions. The respondents are experts when it comes to understanding the questions. So you need to do a pre-testing. You need to take a small group of people, administer the questionnaire, find out what is the difficulty in that. Ultimately, you decide which has to be introduced, what modification you need to do. And if you have a lot of don't know questions in the pre-test, while doing pre-test, then you say that your questionnaire is poorly structured and you are unable to extract the questions answers from the respondents. Ensure that the respondents have no trouble following the instruction and skip patterns. While pre-testing, also you note down the time taken. So lengthy questionnaires may frustrate the respondents and interviews. Generally, what should be the length of questionnaire? It should be sufficient to capture the required data. It should be short enough to hold the participants' attention. The type of survey affects the length, and the type of questions also affect the length. Generally, 30 questions are given as a thumb rule. You should not have more than 30 questions generally, and the rule of thumb also says that the maximum time to complete a questionnaire should be 10 minutes, not more than 10 minutes. If it is more than 10 minutes, then the participants will lose interest in that. Then the method of questionnaires, either you can do postal, phone, electronically, or personally administered. You need to validate the question by adopting various, if it is a previously validated question, like for example, rating scales, Young rating scales, or any other scales which you are taking. This is already validated, which is available in the public domain in the internet. So you need not validate. Only if you are applying it to your setup, you can convert into a local language, then you validate only. So it has to be possibly harmonized with the local setting, not validated. But if you are doing preparing a new questionnaire, you should validate it, and it should be tested also. So pilot it with a small group, do a pre-testing. These are the various steps of questionnaire validation. I'm not going into detail. You need to see the reliability. You need to see the content validity, face validity, construct validity, and reliability also. Let's skip all this in detail because you want to understand much on that. Then few things about the projective techniques, which also is required for data collection. Is a direct, unstructured, indirect questioning. This is usually we adopt this for in small group interviews and individual interviews. The respondents are asked to interpret the behavior of others. So here they are indirectly project their own motives. While doing this, they indirectly project their own motives. Mostly this is being used in psychiatry evaluations, research papers also, to find one person's perspective. It is used. There are different techniques, associative techniques, completion techniques, constructive techniques. I don't think I will go in detail for this, all these things. These are actually, to summarize, this is basically you put some pictures, some movies, and ask the person to analyze, tell his perspective, and you note down the responses. That is what is a projective technique. Then there is Q methodology and Q sort technique. This is also a mixed methodology where we expect a qualitative judgment from the respondents on a particular issue or topic. The participant's viewpoint is recorded, like say pre-recorded sheets will be given, and you ask them to arrange it in a pile and see what is their order of arrangement. All these are studied. This is again in a qualitative perspective it is taken. So they use arrange it in a bell curve method. This is the least preferred, most preferred, and then you study the perspective how they are arranging. So this is called Q sort technique. Then another important is Delphi technique. Now this Delphi technique is an organized method of collecting views and information pertaining to a specific area. A collective human intelligence is extracted from in the study. Judgment and of a group of experts. Here the respondents are a group of experts. Their judgment is taken. Mostly you use it in medical education researches, qualitative research. They are asked to prioritize their choices and make the forecasts based upon their priority. They explore, assess, and evaluate the choices which are there before them. The participants need not have a face-to-face interaction. We can cover the distance also. And the collective response, by filling up the questionnaires, the collective response is collected, and the results are then tabulated, and then they again send it to revise questionnaire again into the large group to find out what is their take on this. This is repeated again and again till they reach a consensus. So this is like this. First round, they go, then give the feedback, then go for second round, then go for third round. This is very much useful for problems which get benefited from a subjective judgment. Then the case studies, we all do this case study. The research approach here is in-depth. Information is collected from a particular case in different angle, multifaceted understanding of a complex issue in a real life context. The interview, spatial analysis, all this can be done in a case study. And the pilot study, we do a small trial run of a larger study. Before going to a larger study, we would like, definitely we won't like to these resources should be used in a proper manner. So we do a preventive, expensive, flawed large study. To prevent that, we go for a pilot study so that the responses can be corrected, the flaws can be corrected. This is also called feasibility study. Then the vignettes. These are the short stories, hypothetical person, and these are basically qualitative data. And within an interview and group discussion, these short stories are given, and then their particular groups, their beliefs and their own set of beliefs are explored through the short story. There are various usage. You can tap. This is used for community studies also. When you go to a new community, you find out what is their perspective. You put a vignette, and then you can get their response. Then sensitive topics can be explored through them, and this is used in multi-method approach. Then integrating all this technology into data collections. The online web-based surveys can be conducted. Handheld devices also, these are various other methods like the personal data collection devices, and then clickers, PDS, all this can be used to collect the data. You might have seen in the KBC, they use this clickers. Through these clickers, they collect the responses from the audience. Then you can collect it from text message. And lastly, this is important, social networking sites can be also effectively used for data collections like Twitter, poll, Facebook poll, all these things. You might have a WhatsApp, through WhatsApp. You can. So the take home message, data collection is a very crucial step of research. The validity, reliability and usability of data depends upon the tools and techniques which are used. Unless and until the tools and techniques are very much specific and robust, your data collection will be flawed, and then it affects the validity. There are different tools and techniques which are used depending upon the study requirements. And as a student research scholar, when you are designing a questionnaire, you should design in such a manner that it should be flawless, it should be accurate, and it should get the maximum desirable data collections. Thank you. This is all about the data collections methods and techniques. Thank you very much. Any questions?
Any questions, doubts you want to clarify? See, because in thesis, you'll be collecting a lot of data and you need to use a lot of these questionnaires and how to select a question. Any doubt you want to clarify?
So many times I see the questionnaires, we just design the questionnaires. One page will be there, age, sex, then there will be some other scribble, BP, pulse, and this, then the questionnaire is over. So that really doesn't extract the number of data which you require. And then you come to statisticians saying that I need the analysis of data. But again, the statistician will be clueless. So there the story starts, data forging, data impersonating, all these things will start. So that should not happen. A good research should be, depends upon a good data. So even if your number sample size is less, try to collect data which is genuine and which is having more relevance.
So if no doubts to clarify, see, we have our professor and HOD of SPM, Dr. Kumar here. Sir, Kumar, sir, would you like to add anything, your insights into this data collection? So anything you would like to add?
Sir hasn't left anything. He has covered everything. In fact, it is exhaustive. Okay. Thank you, sir.
Thanks.
Sir, thank you, sir. It was a very wonderful lecture. So you corrected in detail about the different questionnaires, because see, why we selected this topic, we want you to do a original thesis. So when you are doing your original thesis, you need to collect the data from patients. So that time you cannot directly go to the patient and ask whatever question you want to ask. So this question has got a structure, different types of questions, questionnaires, sir has discussed in detail. So you need to follow all these things and properly, carefully ask a question to the patient. Then only you get the right data. If you have right data only, the analysis will give perfect results for that one. Okay, so I request our Dean Espirao, sir, to give his insights into this data collection tools and techniques.
First of all, let me thank Mishaji for taking pains to come over here and then enlighten you regarding the data collection. What usually happens in thesis writing is you collect some data and then multiply by some factor. It may be 10 or 20 or 30. And then you try to present the data saying that, sir, I have got only 5 cases. You asked me to study 50 cases. So what should I do? 5 multiplied by 10. So comes the whole data. So this kind of methodology is not accepted. Not accepted in the sense, even if you do 5 cases, try to analyze it and present it. There is nothing like, see, thesis is not meant to make you Archimedes or make you into somebody who is a scientist. It is not the purpose of thesis. The purpose of thesis is to make you learn the methodology, how it should be performed. So in that, the most important one is data collection. And data collection, what I have seen is right from undergraduate level, we have not been taught how to collect the data. The most important thing is, suppose there is a past history of collecting data about diabetes or tuberculosis. I used to ask students, how did you know that your patient is not suffering from diabetes? Sir, he used to look at me in a way that even this simplest question also the dean doesn't know. So I asked him, how did you know that your patient is not suffering from diabetes? Sir, inko question pucha, are you suffering from diabetes? He said, no, that's why I wrote in the past history, there is no history of diabetes. It is as simple as that. So this kind of data collection will take you nowhere. So you have to see how, if your objective is to collect data about diabetes, then you must be able to ask 10 questions or 1,000 questions to find out whether the individual is suffering from diabetes or not. So I thank Dr. Mishaji, who had taken a lot of pains to come over here, and especially immediately after lunch, he took over this lecture. Thank you, sir. Thank you very much. And I hope you all will be able to do it, your thesis in a sincere manner. I don't mind even if you do for 10 cases or 20 cases, but do it sincerely. So that will fetch you more fruits rather than falsifying the data and producing table thesis. Thank you very much.
Sir, please stay back, sir. We have a small felicitation. Okay. Right. See, I request Dean, sir, to felicitate Dr. Sushant Mitra with the shawl. Shawl of it. Student. So one of the PG can come here. So one of you. So it's better if girls can come. It looks odd because someone is forcing Riaz to come. It looks very odd, Riaz carrying a shawl. So one of the girls from next bench, you can come over. Yeah. So then I need to ask my surgery PGs. Yeah, please. Shruti, come here. We have our Deputy Superintendent, Dr. Pratima ma'am here. So ma'am, can you please come to present the memento to Sushant Mishra? See, Pratima ma'am is very enthusiastic. Whenever a medical education program is there, like a student, she is the first one to come. She will come in spite of her busy schedule. She will be coming and attending medical education classes. So, right. So thank you all for your wonderful participation. See, you have any doubts regarding data collection or anything, you can later, I'll circulate the mail ID of Dr. Sushant Mishra. So you have any doubts or anything you need to clarify more, you can put a mail. Sir is very much accessible on mail. He will answer your doubts. Right. Thank you. Thank you.